Well, welcome back to Great Day Washington. If pain is an everyday part of your life, then we have some important information to share.
Chronic pain is something that you do not have to live with. And here to share more about an advanced laser robotic treatment is Dr. M. Scott White, D.C., of New Life Laser. There he is.
Hey,
hi, doctor.
It's good to see you guys. Listen, we've got to stop the madness. Last year, 2 million people died from prescription painkillers. 2 million. That's more than heroin. You know, I saw a chart where 12 of our states here in the United States have more opioid-based pain reliever prescriptions than people in the population. That's crazy. Listen, we've got to do things better. And the way we do that is with the robotic deep tissue laser. This machine is incredible. There's no cutting or downtime. There's no tissue destruction. It doesn't hurt. It's painless. And it removes pain. Extreme pain can be helped with this. And more than that, it actually causes tissue regeneration. So if you have to keep taking pills, you're obviously not fixing the problem. And look, here's the big deal. We're living longer. At 30, 40, 50, 60, all the pills, the surgeries, all the stuff we do to our bodies, look, we're living to be 70, 80, 90. My oldest patient's 101 now.
Wow.
So we've got to take good care of ourselves, make right choices. These drugs aren't good for us. Even ibuprofen, people take that on a daily basis to deal with pain. And listen, it hurts your liver, it hurts your kidneys. It's not good for you. And where are you going to live if your body wears out, right? So the whole deal is this. The deep tissue robotic laser is a better way at dealing with pain.
But Dr. White, where can you use this robotic laser?
We can use the laser on any area except for the eyes. So we do backs, knees, hips, any joint, anywhere where you're having pain. And 7 out of 10 of our patients feel better even after the first treatment. Now, I want to talk about knees today.
How come they get older than the rest of us first? Knees. Well,
it seems like it, but it's the wear and tear on them, right?
Oh, yeah.
Going upstairs, literally 3 times your body weight on that joint. But listen, okay, Marquette, this is for you.
Okay.
What's the biggest joint in your body? And it's not Chris's mouth.
I didn't know I was going to be quizzed today, Dr. White.
Guess.
The knee.
The knee. And listen.
Bigger than the hip.
Bigger than the hip. And listen, it's a very complex joint God created. It's got 4 bones associated with it, 14 ligaments, and 12 muscles. So there's a lot of opportunity for things to go bad. And listen, steroid shots are not good for knees. Every time you get a steroid shot, a cortisone shot, it breaks down the tissues further, and arthritis ensues and actually accelerates. So we want to do the laser on these knees. It's amazing for knees.
You know, Dr. White, we were doing that movie, Maudie, and the lady had arthritis. I was thinking, I wish they had the robotic deep tissue laser.
That would have been awesome.
Yeah.
But listen, I want people to know this.
Yes.
Knee replacements, they're giving them out like, you know, stuff at Costco. We've got to stay away from surgery when we can. 1 in 400 people that do a knee replacement are dead within 30 days.
Oh, my God.
So the whole idea is we want to do something different, something better. 40 to 70% success with knees, even when it's bone on bone.
Yeah, well, what I would do is I call Dr. M. Scott White.
Well, listen,
New Life Laser.
We got a picture I want you to see. Put it up there.
We have a picture.
There you go. Who is that?
King Tut.
Yes.
Yeah.
And people think now they did a CT scan on his body, on his mummy, not his mom, but his mummy, and they think that he actually had a problem with his knee that killed him. So don't do that.
Where did he go for more info?
We're going to call 1-888-PAIN-FREE. That's 1-888-PAIN-FREE. Now, when you call that number, we're going to do a completely no-charge first visit. You have to tell them that you saw Dr. White on Great Day, Washington. You can go to any of my 4 locations, Woodbridge, Bethesda, Arlington, or Fairfax. Completely no-charge first visit.
And he'll give you a big, quick look at King Tut's knees, maybe, if you do it. Thank you so much, Dr. M. Scott White, D.C. Hey, we're going to be right back after the great. Stay here with Great Day Washington.
Spend an